this was must have been captured in our earlier report the last time that I was here, and in general in the last report. However, I wish to seek your permission that before the close of business today, let us write to you this in writing and show you, share with you this information. However, if still we could have the clerks here print them, we could as well then send now and they are printed and circulated among the members, so that at least we do not respond to one question at a time, and to also save your time. Okay, that's our work.
Okay, we will have a question on that report. You have it. Later on, you are required to submit any document or any information you have it to the Secretariat. You have no problem. Let's go directly to the questions.
I think my question was not Chair. I have a very funny. Chair. Chair. If you can send to the Secretariat and we get the printed copies, it will be better for us.
Honourable members, let's agree on something. Are we making
one thing to clarify? I don't want us to go over that point. Chair, I think the issue of giving blanket, the issue of you just giving blanket explanation, some of the questions are not fair. Sincerely speaking, Chair, there is no insecurity in cancer. So I think it is going to be very unfair to the people of Cancer and the surrounding area. And I know that this cancer is having a very big area of nomadic community. So when the director is giving a very blanket insecurity issue, there is no insecurity, the people are living peacefully with cancer, but we want clear other explanations, maybe on each dispensary, why it is closed and the purpose, and what happened, and specific on to be specific on each dispensary. But when you say there's insecurity, I mean, you are not giving service to the people of cancer, I think it's not fair.
Okay, I think when Waziri, you have noted the questions from Mheshimiwa Board. Then I will give Mheshimiwa Hamdi, Mheshimiwa Ijara, and Mheshimiwa Saga for follow-up questions. Those 4 follow-up questions. Mheshimiwa Waziri, whatever you say here, you should substantiate. You should not generalize. This matter is very sensitive. And as well, where these members, they came from different wards and they understand their wards, what's going on. So whatever you say here, you should substantiate and say why each dispensary is closed. Giving reasons by base, through by words. Please go ahead, Mheshimiwa Saka. And then followed by Mheshimiwa Ijara and Hamdi. Follow-up questions? Yes. You had follow-up questions? No, leave it. Mheshimiwa Ijara?
Thank you very much, Waziri, and your team. In my ward, I have 2 health centers which are not operational, and we have already mentioned it. We know some circumstances that there's some health centers are not operational. Yes, we understand. But you have mentioned another health center which is not operational and it's not in security area zone. I don't know why, and I have several seen no action has been taken so far. So kindly, that center is Biltobama. I need a calamity please. And also, you also add Sangoli, it's not that much insecurity. And I need a calamity also, please. Thank you very much.
follow-up question?
It was point of information that I wanted to inform the honorable member for the Majali that when the team arrived, the first thing they requested you was that they were using their mobile phones as their computers, and you are the chair here guiding the honorable members. That was.
Okay, we'll note it. Waziri, go ahead with your question.
Honorable Chair, I'm so sorry if I did not come out clearly, and I do not want to pass the wrong information. I want to pass the right information here. I say that as I was referring to the areas where insecurity is not directly affected, there was an indirect effect. We do know very well that there's a situation where when there's an insecurity incident in some areas, all the other mainly people who do not hail from Garissa County, do not want to call Kenyan and local, but all the people who do not come from Garissa County do take advantage of that, and sometimes, even not even take advantage, but even have genuine fears and even desert duties. And I know very well, of course, the situation in Lagdera and even other parts. We do not want to generalize, but this is what has actually happened. And a specific instance, to put it into context, the staff that actually presented there, the main staff that actually presented there was non-Somali. And in most of our facilities, yes, we have told you that we are operating with the narrowest or the smallest unit of staff possible. And when such staff, or one or two of them that serve, then and with the kind of shortage that we do have, then it becomes a bit of a problem. And I also explained clearly on the issue of HR, which we said that initially we wanted to fill the vacancies even through locums and through other arrangement that was possible, with even respect to the issues with the board that was not properly constituted and all that. But then we were challenged, and there is that general feeling everywhere that maybe health is even overstaffed. But honestly, from where we stand, we know that we are very much understaffed. And this is what we are pushing for. This is what we'll ask the honorable members. And in the last time that I was here, I very much remember, and I say that has to go to the answer, that in as much as we are pushing as a department, because there are other also entities in the county that are involved and other departments, help us in also trying to push for this, but on our part, we did it, and it's not that we are abdicating our duties. It is something that in the pipeline, and hopefully when the results of that, the latest headcount that was done comes out, I'm sure on the facilities that are closed because of lack of HR, all of them will be open. Having said that, and I wish also to remind the Honorable Chair, to remind the Honorable members that still we may employ on maybe started on a long-term basis, so at least it saves us from procedure, long procedure of employment and all that. But still, we'll have to
Timeline, please, of that.
Pardon?
The local staff.
Yeah, we did not yet get, because it was not being conducted by a department, it was actually being conducted by the office of the county secretary. We are waiting for information on that. I think it has just been completed. And once it is completed, the information that we have is that immediately we can be given the green light. But on our part, we did the mapping, we know the staff jobs that we have, and we know which facility needs how many staff. So this is the information that we are actually waiting for.
Chair, perhaps a point of order.
No.
Just a point of order.
Chair,
General one.
your question?
It's not a question, it's a general one.
Reminder, please.
It was, yeah.
Give the mic.
Okay, I think it's general.
General.
No, it's okay. I got
Yes.
through the chair.
Go ahead, please. Answer, please.
Okay, thank you much more. And for Shimri, yes, it was advertised. And from the information that it has reached from the department was that the people who have applied has not met the minimum qualification. So, and the tender was cancelled. So that is the communication we got from the procurement teams, which went through for evaluations and all those things. So the award has never reached in our desk, but initially it was advertised. So that's it. For Shabah, yes, you are right. There's a dispensary in Shabah, which was constructed through Qatar charity. And although in the initial phase, this was not involved with the health department when it was being constructed, but when you are doing mapping for health facilities which were not operational, it's actually found the facility that we have mapped, and as the Wazir said, some of the healthcare workers that were waiting from once we get them, it is earmarked for operationalization.
Point of order, Chair. That's a general.
No. General.
Yes, general, yeah, not a question.
Yes. Go ahead.
Through the chair.
Order, please. Sit down. No, sit down.
Chair, this is implementation committee. I can see we are losing focus. This is not a normal departmental committee. The CEC and the team are in the assembly understanding orders 1924 to provide a report. And the function of the implementation committee is to scrutinize resolution of the county assembly, including the adopted reports. What we are discussing is an adopted report of the health committee. We are looking at whether the resolutions of the house have been implemented, to what extent they have been implemented, and if they have been implemented within the minimum time. The standing orders has given the CEC 60 days to report on the implementation. If we talk about those dispensaries that are not operational, my good friend the CEC comes from Baraki. I come from Baraki. The nurse who is manning Baraki is not employed. We have just taken him there because he's a local. We want to know. And this committee is vested with us. Chair, give me a minute. You can propose even sanctions against the CEC. What we are discussing today should not be why Shabah was not done this, why it was not done. It's a general. Why all the dispensaries are not implemented? At what extent is the CEC and the team doing the implementation? If they are not serious and there are no actionable plans from the department, then the committee should now adopt sanctions against the committee, against the CEC and the team, according to the standing orders. But if you say Barak is not operationalized, Barakis is not operationalized, that is not the mandate of the implementation committee. The implementation committee is the biggest committee in this house. It's not a departmental committee to know about the fault finding. This is to make sure that to what extent the resolutions have been implemented. Thank you.
Order Hassan Gile, Mashma Hassan. We are not matter of calorie here. What we are looking is the documents that they have for it. Then as a house, then we will come back to the house with the report from the CSC. Then what will we look forward on that matter. One member, let's go direct to questions on matters of the reports and motions that we have passed here. I want to give first question to Commissioner. Second question, Honorable Hamdi. Third question, Mashima Ahmed Nur. And then we see questions. What's the point of order?
Thank you, Chair. Chair, I think this is the point that Mashima Hassan is raising. I personally highlighted before the CEC came in. We want the department and the CEC to understand that's why they are here. They are here because a resolution and a motion was passed in this assembly and giving an opportunity to the department to undertake or implement those resolutions and those motions. And as Asangeli has stated in the standing order, the department had 60 days to do the implementation. The 60 days have elapsed. And that is why today they are here, not in front of the health committee, but in front of the implementation committee. And why they are here is the department to tell us on the resolutions and the motions that have been passed, how far have they implemented? At what percentage? And those resolutions and motions that were not implemented, why it was not implemented? That is where they are work will end. But again, now coming back here and members asking in my ward, this facility, we are losing track.
Chair,
So, Chair, Chair, we need your guidance. Kindly, your guidance should be based on the standing order and the powers that were given by the standing order to this implementation committee. So that after we get that report from the CDC and his team on the level of implementation, now it is this committee to retreat back and come up with a report. Thank you.
Chair,
Okay, what's the point of order? Thank you, Chair. Chair, I just want to, and if we go back even to the starting order, the implementation committee is the one of the powerful committees in this House, Chair. And I think we set the questions. It is us who set these questions. It says, the first question where the member for Lamasiga has asked was, how many of 24 non-operations have been rehabilitated? And when we are talking about rehabilitation, we are talking about the infrastructure, right? We are talking about infrastructure, that's dispensaries. And all, Chair, now what's the question? I'm coming to my point, Chair. When a member asked about an infrastructure that was advertised in his ward, because I represent a ward and he represents a ward, and I think Honorable Adija doesn't represent a ward, he's just a nominated. Chair, if I ask issues concerning my ward, we should not bother her. It should not be an issue, Chair. And I think you need to take up your role as a chair. We respect you as a chair. But if I raise an issue in my ward regarding facilities, somebody should not. You are not in order, I think you should have guidance. Order, please. Order, please. Order, please.
Point of order.
Order, please. You have to. You have to
protect the nominated members.
You have to retract that statement. You have to retract and apologize that statement, please. No, they are representing the people of Garissa County.
Special interest.
Special interest.
You must
Do the
apologize.
statement from Bablahi at the Haman board and apologize.
You must apologize.
Give the mic. Give the mic. Chair, as I apologize, I want to say that I represent a ward and I must ask and then represent the people of Garissa. Yeah, that's it. Okay, honorable members, let's go to the question directly. I'm not stop on follow-up questions. No. Let's go to the question, please.
Thank you, Chair. Thank you, Chair. I think on the first one, the 24. Yeah, I'm coming to the question. Before that, I want to clarify one thing, Chair. The 24 facilities, those was a report that we got from the department. If it is 28, it's still okay. What we wanted is with evidence that out of the 28, in terms of infrastructure, how many are fully now operational? In terms of the structure itself and personnel itself, and how many are still not yet fully operational. So that one, it's advisable, not in terms of, we need to get whatever we're saying, we need to be under, with written, with the documentation regarding that, so that later on we say this 10 has been operationalized.
Honorable members, hello,
we are remaining with 18.
Please consult.
Chair, let me continue. The other thing is the director saying that we have shared this on with the CS. It's advisable that we get that report because it will going to help us. It's possible that we are crucifying you for not apparent reason.
Honorable members, Sergeant Adam, where's Sergeant Adam? Remove Mr. Abdulrahman from the session.
You want him? Chair.
Chair, just give me a warning, please.
Give him a warning.
Give a warning,
I
please.
can move out, but not abide and chair.
You are not consulting.
We are consulting not the villa. We don't have positions. And I thought we have been reconciling. Why you remove me?
Okay, Chair, let me continue with my.
Go ahead, we are
All members, you have a seat. Consult in a manner whereby you cannot be disrupt the agenda of the today. Let's go to the question.
Thank you, Chair. My question is, what are the strategic measures to address staff shortage across health facilities in the county? Together with that, how is your department involved in training and professional development of healthcare? Give us, there are concerns by the respective boards, the elected MCS and also nominated ones, regarding the shortage of the staff. So in terms of these staffs with redeployment of the staff, already you have staffs that are working, maybe they are based in Garissa and want to redeploy to other health facilities that have no staff, and maybe there are gaps and you want new recruitment and staff. So we want the department to address that. If you have already generated reports on the gaps on the specific health facilities, where are those reports? Have you shared with the recruiting entity? It's advisable that we also share that report with the committees for follow-up.
Second question. You asked two. Let's go to the question 4 for 3.
Thank you, Honorable Chair. Before I ask my question, Honorable Chair, with your permission, I want to tell Honorable Board that he is elected through the ballot and we are elected through party list. I will represent the people of Garissa, especially women, PWD and youth.
What's your question, please?
My question, how has the county government invested in the automation? Banawaziri, I want your attention, please. How has the county government invested in the automation of revenue collection and management in the health centers?
Question 4.
Thank you, Chair. Welcome, Waziri and your technical team. My question is, has the government prepared all non-operational ambulances in all sub-counties? If no, what are your future plans? How has the non-operationalization of the ambulances affected the delivery of emergency medical services? Is there a maintenance and services scheduled to prevent future breakdowns? Thank you, Chair.
You can answer, Banawaziri.
Thank you very much, Honorable Chair. Honorable Chair, there is a matter that I wish to bring to your attention and on which I will seek your guidance. First of all, with all due respect, even in all my written communications to this House, we do always communicate that we have all the utmost respect for the House and actually welcome the oversight role that we place. And we see that you are partnering actually with us in improving services, something that we really appreciate. And on that note, we do not want to breach or disregard any of the rules of the House which are there in place. With respect to that, and in light of what I have mentioned, as a precursor to what I would wish to say now, is that in the communication that was made by this Honorable August House, in which we were informed about the motions that were passed. I have the letter here and I seek your indulgence, the letter that we received and that which is actually stamped received. And once I read it, I will wish to seek your guidance, Honorable Chair. As I seek your guidance, as I'm trying to, just had it, I don't know why it got lost. When the motions were passed, or rather the reports were adopted, the communication we got, I'm very sure, which is also within your file, did not give us any timeline. It did not give us any timeline. We are not privy to the standing orders of the House. It did not quote any standing order. If it had quoted any standing order, and I wish even, I'm very much confident that I wish your clerks maybe to even bring that document. If it had quoted any standing order requiring us that there is any information that we needed to report that within 60 days we will have done. So I wish to read for you one of them. So I wish to seek, and we do not actually, I don't know whether this report is supposed to be a restricted report that we are not supposed to receive. It was supposed to be attached maybe, and we also be privy to all the information that's in the necessary standing orders that are there, so that we also, do not look like we are headless chicken before you. It's quite embarrassing. Well, lack of knowledge actually is not any defense, but lack of knowledge of this House, you have never served in this House, lack of knowledge of the standing orders of the House should not be used against us, particularly in a circumstance in which there was no standing order that was quoted. So, with all respect to the matter that was raised on the powers of the implementation committee, and it was supposed to be doing on the status and all that, we thought that by that invitation, we will give all the information today, and I said before the close of business today, we will submit all the information in writing.
Thank you, Chair. Let me clarify that one. CEC, there is a letter written to you on 17th October 2023. The letter was received by the Directorate of Health, and the letter reads: County Assembly Resolution. The third County Assembly passed the resolution below that requires implementation by the Department 1. Motion urging the County Executive Committee member of Health to improve the condition for Alikune, Abakaile, and Polmato dispensaries, and deployment of health personnel and facilitating the management of health units at ward level. 2. Motion urging the County Department of Health to roll out campaign to sensitize the public and embark on vaccination and exercise aimed at reducing the spread of measles disease in the county. 3.
That's fine.
You have that one. So under that one, it says that this is in accordance with Standing Order 182 of the County Assembly, which provides that within 60 days of the resolution, of the County Assembly or adoption of the report, a select committee, the relevant member of the County Executive, under whose portfolio the implementation of the resolution falls, shall provide a report to the relevant committee of the County Assembly in accordance with Article 153(4)(b) of the Constitution.
Honorable Chair, I have that letter, and I wish to respond as follows. I know of 182, the standing order 182.
Your mic is not on.
Honorable Chair, I'm aware of actually that's the letter that I have here. It is before me. I know of standing order 182, I've gone through it. And standing order 182 does not explicitly, if you actually open it, say that within 60 days. I'm not sure whether it says within 60 days, but it refers to the Constitution of Kenya 153.
Waziri, I want to for you the standing 182.
Okay, please, yeah.
Reports on county assembly resolutions. Within 60 days of a resolution of a county assembly or adoption of a report of a select committee, the relevant CEC under whose portfolio the implementation of the resolution shall fall, provide a report to a relevant committee of a county assembly in accordance with Article 153(4)(b) of the Constitution. So whatever we have a resolution here, or a motion, you have a guideline. You have a deadline of 60 days to implement that resolution or motions.
Thank you, Honorable Chair. Thank you, Honorable Chair. It refers to, and this is where the confusion actually comes from, and I seek guidance. It's not that I'm knowledgeable, I'm just seeking guidance. If we refer to the Constitution of Kenya 153, some standing order, it refers to the Constitution of Kenya. I think that standing order refers, it says in accordance with 153. Yes. 153 Constitution of Kenya. Maybe probably quickly we also go through that so that we see things, and this actually for the benefit of all of us.